Hey guys, I'm Bryn. This is Heather. We are Pharmacists Out of the Box, and we are here talking with chiropractors today. We are super excited. I just actually got done with a treatment with my son and I, so we kind of maybe go every few weeks, and it is super helpful. So today we have something special and something hopefully new that you're learning about.
Yeah, I think it's great. I think these guests are going to be amazing, but I may be biased. I'll have to be transparent and say that Brittany is actually my daughter and Shane is my son-in-law. And they actually, Brittany adjusted me yesterday, so I feel amazing.
Right.
But we really thought, like, who better to bring on to share with you guys. Because I don't think, not everybody knows the benefits of chiropractors. I think there's some people who use them and there's some people who are like, I don't even know what that is or how it could even help. And I think for those of you out there who are pharmacists, you know, we have patients who come to us for all kinds of aches and pains and issues and just health issues that just want to be healthier. And I think just understanding the benefits of what a chiropractor can do would just broaden your tool belt of what you can offer your patients or people you know even. So I'm excited. I think they have some great stuff to share. So welcome, you guys.
Yeah, thank you.
We're happy to be here.
Yeah, glad to be on.
And so it's Dr. Brittany and Dr. Shane Semegon. So their last name is very beautiful and very unique.
Yeah.
And we'll make sure you have all the information down below of how to reach them and how to find them. So thank you guys. So I think it was interesting, Bryn, we were talking before we even started. I think your question is a great one to start out with is like, how did you guys become interested in chiropractors or being a
Right. Like, I didn't even know about it growing up. I mean, I just kind of had this vision, like it's just for people who are in accidents or had an injury. I didn't realize how much it could be used for preventative medicine. I guess what originally drove me to a chiropractor was when I started doing 13-hour shifts in my job. You're standing all day, you're on the phone and your neck hurts. And I actually developed like severe like neck pain. And so my hairdresser had told me about her chiropractor. So just word of mouth, I was like, oh, it's worth a try. And I was shocked. I was really unbelievably shocked how quickly it worked for me and just the amount of relief. So now I just kind of go when needed, sometimes semi-regularly. It just depends on life. But I was surprised because Shane said he actually had this done like day 0. So I'm just always curious how people kind of get into it or when they maybe first experience their first adjustment.
Yeah. So my father was a chiropractor, and he's in Jacksonville, Florida. And so when I was born, a lot of people don't think about how stressful birth is on a baby. But when I was born, you know, they grabbed my head and they're pulling my entire body out by my head and twisting and rotating and pulling me out. And so oftentimes during that process, a misalignment can occur in the neck that affects the baby. And so as soon as I was born, before my umbilical cord was cut, my dad checked my neck for a misalignment and did a very gentle adjustment. Takes 1 to 2 pounds of pressure and adjusted me. So I got my first adjustment right off the bat. And then from there, I was just adjusted as a kid growing up. As I was crashing and burning and learning to walk and being a kid, my spine was checked throughout. And so that was my introduction, and spent a lot of time in his office growing up. And it was really cool to be a part of that and just see the energy and excitement of people coming into his office. So it really drew me into chiropractic.
Wow, that's so interesting. So did you have a home birth where they didn't cut the cord right away? Like your dad could actually adjust you?
Yeah.
I was wondering how that happened. That's awesome.
Yeah.
That is really cool. Do you have other brothers and sisters that he was adjusting as well?
Nope. Spoiled only child.
Nice.
So Brittany, how did you get interested? That's a curiosity for me. We've always kind of been intrigued by Brittany's story. So,
You know, I always wanted a career that was hands-on. I was really big into sports. So I don't know how chiropractic came in my life. It just was like one day I was like, I think I'm going to be a chiropractor. And then did all of my school projects and research papers on chiropractic and toured and shadowed offices. And actually, I was going to be a sports chiropractor until I was actually adjusted on a care plan. And before I was being adjusted, I had migraines and headaches couple times a week. I had kidney stones. I had really bad recurrent colds. And since being adjusted, I haven't passed a single kidney stone. I don't have like migraines, and if I do get a headache, it's very rare. So we've kind of shifted from being sports focused to being family and pediatric and maternal focused. So being proactive with children's health and adult health as well.
That is so interesting. So you were interested in like researching and thinking about chiropractic even before you had actually experienced an adjustment?
Yeah.
That is really cool.
Yeah.
Did you like hear about it at a career day or like even remember?
I honestly have no idea how I heard about chiropractic. It must have been a God thing. Like he just spoke it into my life, and I'm grateful.
That's awesome.
So go ahead. Bryn.
No, you go.
No, I was just going to say, so now that you guys have been in it and you've learned all about it, like what would you tell somebody who is wondering, like, well, what do you guys do? What does a chiropractic even do, or specifically what you guys do?
Yeah, that's a great question. So as chiropractors, the reason that we focus on the spine is because the spine houses and protects the nervous system. And we know from Gray's Anatomy and multiple textbooks that the nervous system controls and coordinates every system in the entire body. And so when the spine is misaligned or moving improperly, it affects the nervous system and affects whatever those nerves go to control and coordinate. So we see tons of different things improve as we're improving the spine and the function of the nervous system. We see headaches and migraines improve, blood pressure issues improve, asthma, digestive issues, and many more because of the close relationship between the spine and the nervous system.
That's
and so
cool.
what we do is by realigning the spine, we improve the function of the nervous system.
So like Bryn said, yeah, we help with pain in our neck and low back pain. That's what most chiropractors are known for, is neck pain, back pain, headaches. But we do so much more for the body.
Well, you mentioned like hypertension. So, can you give us some more information on that? Tell us more about like, how do you do that, or how does that happen?
Sure. So there's a lot of things that control your blood pressure in your body. But one of the main holds for them is your midbrain or your brainstem. And so your brainstem's controlling breathing, respiration, heart rate, blood pressure. And I'm actually going to bring up a little diagram to help show this.
For those of you driving, you can check it out on YouTube later.
Yeah, don't look at it while you drive. Or you'll really need a chiropractor. Okay, so this bone right here is that first bone in our neck. It's known as the atlas vertebrae. And our brainstem stops right before and travels a little bit into that canal where that first bone in our neck is. And then the brainstem transitions to the spinal cord that also travels through all the vertebrae all the way down. And then from the spinal cord, there's nerves that exit the spinal cord through the spinal bones. And those go to every organ, cell, tissue, muscle of our bodies. And that's how our brains get to control the rest of our bodies from being up here and all our organs and cells and tissues being down here. So when we adjust this first bone in our neck, we're influencing the function of our brainstem. And so if that is not getting the proper impulses from our brain to the rest of our body, we can experience high blood pressure from that. For our brains not being able to communicate properly to that part of the body. But also, kidneys have a huge role in blood pressure as well. So we can, if there's a misalignment in their low back where their nerves are going to control their kidneys, we can also see improvement in high blood pressure. And our heart is also another key role in regulating heart rate and blood pressure as well. So if there's a misalignment in our upper back, we can experience high blood pressure. And also if we're correcting that misalignment, we see high blood pressure improve.
Now I know everybody's kind of different, but like what kind of time frame estimate? Is it like a month of adjustment? Is it earlier caught, then easier to kind of catch it and fix it?
That's actually a really good question. So like you said, each and every person is different. They've experienced different things throughout their life. So some people can have had car accidents, and some people have had a fairly stress-free lifestyle. So really until we see x-rays to see how long the misalignment has been there, we can't really say. It could take a couple weeks for some people. It could take a couple years for other people that have been having misalignment since they were children. And now they're facing high blood pressure as mid to late adults. So it really just depends.
And I think it's really cool, like to those of us who live in the world of medication, I mean, the targets you're talking about just make total sense. I mean, that's how our medications work, or through the kidneys, through the heart. So, I mean, it makes total sense how they just align. What you guys are doing just aligns with obviously what is truly affecting blood pressure. And so I think I could speak, Bryn probably could speak too, that we see a lot of patients on a lot of different medications, working through their kidneys, working through their hearts, are on a lot of medications. And so many of our patients want another alternative to just taking more medication. So it sounds like you guys are a good fit for that.
Would there be any risk for like high blood pressure? Like, I don't know if somehow like an adjustment worsens their situation. I mean, I guess you can't really control necessarily the stress in their lives or what they're eating, some other factors, but is there any risk to being adjusted with an increase in blood pressure for some?
Not that we've seen. The more the risk comes from people being on high blood pressure medication and getting adjusted and their blood pressure dropping way too low.
It's good to have your blood pressure monitored while you're making improvements and changes, because if you're taking a blood pressure medication and that's lowering it, and then your blood pressure starts to improve, it can get lower than it should. So it's good for that we monitor people's health, blood pressure, and things like that as their body's improving. And with a chiropractic adjustment, it doesn't make your blood pressure go down. What it does is improve the way your body works, allows your body to get back to homeostasis. And so it's not going to make it do anything, but as it improves and heals, lowering is what needs to happen. That will occur.
Right.
And you guys should check out, and we'll post it you guys can post it on the podcast, blogcast, however you say it. There's a great study. And if you Google chiropractic and blood pressure, one of the first things that pops up is a WebMD article entitled Chiropractic Cuts Blood Pressure. And we'll post that. And it's a great article that goes over a study they did with an MD, a cardiologist, and a chiropractor that saw, as they improved the alignment of the spine, normalizations in blood pressure. They said in the study it was equivalent to 2 blood pressure medications. So that's a pretty cool study to check out.
That's awesome. Very nice.
That is cool. And I'll be the kind of floofy one again, like that's my role to be that wooey person. But it just makes, I just think it just makes sense to just align your body or get the pathways coordinated where they need to be. Just makes total sense of like things functioning so much better. And I've been taking a yoga teacher training and learning more about energy pathways, like and meridians and all kinds of things that are also in our bodies that, again, if we can just align them and work within them and improve their flow, then great things happen naturally. Just that your body is an amazing machine that can do these incredible things if we can just give it the right healthy space to do it in. Yeah.
We completely believe that our bodies were designed and created to heal. I mean, from physiology, we know that there's all these ways your body heals and compensates. And so the more things that you do to improve the way your body works and help it be healthy and function better, the healthier you're going to be, the more you're going to heal. And that includes diet, exercise, yoga is great, chiropractic, and many other things you can do to help your body heal naturally.
Yeah. And what about, there are certain things people aren't willing to give up or change for blood pressure, like smoking comes to mind for me. So would a smoker who's going to relatively stay smoking and eating the same thing and potentially the same stress level, is something like chiropractic care really going to make a difference for their blood pressure, even if they're going to continue the other lifestyle?
Yeah, because it is, if you do have nerve interference or a misalignment affecting your nervous system, it's going to be affecting your body's ability to adapt to outside stressors. So it's going to benefit you. Now, if you're still smoking and eating bad foods, you're certainly, that is going to affect the amount of healing you do. But if there is a nerve interference or an issue in your spine and nervous system, you're going to see a benefit, but it will be limited, of course, by your lifestyle.
Gotcha.
Yeah, I think there is a limit to our bodies to what we can do and expect results. One thing I just thought of that I think would be good for you guys to address, because I think there might be some fear in going to a chiropractor of like, oh my gosh, they crack you, or they could break my neck, or they could, I don't know, I don't want them, it's kind of fearful for some people. So what do you say to those people who are like, well, that sounds really good, I'd love to kind of work on my blood pressure or maybe get in better health, but I'm scared? Like, what do you say to that?
Right, there's a couple ways you can go about it. For us, for instance, we use instrument adjusting. So there's no twisting, popping, cracking. The practice member lays face down in a neutral, relaxed position, and we get to adjust them that way. It allows us to be more specific, and it also helps people who are actually afraid of having their neck all twisted up. But also, we go through us and every other chiropractor out there goes through so many hours of adjusting to make sure that we're doing it properly. And it's not like what you see in the movies where people can just twist your neck and and just sever your spinal cord.
In chiropractic school, we figure out what's the right amount of force by adjusting each other, and we're all still alive. But we're training during that time of only providing the right amount of force and not too much.
And you said you used instruments. Is it like that little like a pin jabber thingy?
Can I grab it?
Yep.
Yeah, grab it. I think that's good for people to see, because
right.
I know I've kind of seen those and had those used on me, and when you see it, you're gonna be like, oh yeah, right. That's like nothing. Like it doesn't look like much at all.
Yeah.
But
So like that's gonna move my pelvis. Yeah, right. But it's pretty powerful. This is how it looks. It's called the integrator. There's also the activator, which we use. A lot of chiropractors use the activator. We use those on children in the upper neck. But this can be used all the way down the spine. And you pull it to cock it. Pull it to cock it up. It's locked. And then this is firing. So when we're on the actual segment that we want to adjust, just push down and the mechanism actually fires for us. So the force is the same every single time we're adjusting you. We're very consistent. And because it's so small, like you can see how tiny the white surface area is, we're able to get on very specific parts of your spine. So we're only affecting one segment, whereas a manual adjustment, we could affect up to 3 or 4.
And all that force and energy is transmitted over a smaller area. So it's more force per square centimeter to provide that force. So it's gentle at the same time being very effective.
And that makes, go ahead. I'm sorry, Bryn. Did you have a question?
Yeah, no, that's interesting. Like that it can deliver so much force with just a small little point and kind of give you that precision. So it sounds like there's not like a lot of like manual manipulation that you two utilize. Are there other, I guess, non-manipulation techniques? Because a lot of the chiropractors I've been to maybe have like supplement or nutrition advice or I don't know, other things they might throw at you or ideas to change up in your life.
As far as adjusting goes, it's either with the hands or with the instrument in terms of improving the alignment of the spine. And there's certainly other things that chiropractors can advise on, just as far as healthy habits and lifestyle changes that can be made, for sure. one thing too, before we move on, as far as a big concern for a lot of people, and it's kind of a big thing in the news, has been strokes in chiropractic care. So I think that's important to cover. A great study, and we can post this too. Look, I'm a nerd. I always looking at studies. One study they did was a big insurance company. It was Optum Health Insurance. Looked at people who were receiving chiropractic care and people who were visiting their primary care practitioner, and looking at the occurrences of vertebral, I forget the word now, vertebrobasilar artery dissection, which causes strokes. And what they saw is that whether you went to your chiropractor or you went to the primary care physician, it didn't make a change in the occurrence of a stroke. So what that tells us is that when people are having stroke symptoms or stroke issues, which is usually neck pain and headaches, they're either going to a chiropractor or a doctor to get checked out. And so while people having a stroke or vertebral artery dissection have visited chiropractors, they're also visiting primary care practitioners, and there's no increased occurrence from going to a chiropractor. So I think that's definitely one concern that a lot of people have, and there's a lot of good studies out there showing how safe and how effective chiropractic is in not causing issues.
Yeah, because it is scary, I think, for some people. And I think you mentioned, you as a child being adjusted. And I think that's something you mentioned, Brittany, that you guys want to focus on is like family, like health from kind of day one. So that's kind of another fearful thing, right? As in a child. So, oh my gosh, you're going to like affect, do this to a child,
Right.
Yeah.
Just like with adults and children, you don't treat children the same as adults. And so with us, we don't use the instrument on infants. We actually use our little pinkies, and we apply, it's a sustained contact, so we're not thrusting or anything. And it's 1 to 2 pounds of pressure. So that's about the amount of pressure you would check if an avocado or tomato is ripe. That's how much pressure we're putting on a baby or an infant. So once they start getting to the sitting, walking age, we'll start using the activator. This is a little gentler than the integrator that we showed you guys. And then they progress as they grow up into using the integrator.
Mm-hmm.
Pinkies are just putting a slight amount of pressure. There's not quick twisting or anything like that.
Yeah.
So with babies, a lot of people come in with their babies are suffering with ear infections, colic, reflux, trouble breastfeeding, irritability, trouble sleeping. And that affects the whole family, not just the infant's health, but also not allowing family members to sleep and relax and be stressed as well.
There's nothing more rewarding than adjusting a baby who has a misalignment. They're irritable and having reflux, adjusting a baby, and the parents coming in and saying, we're sleeping and we feel
Thank you.
Yeah.
Well, Shane, I know you worked for like a couple of years now already. Do you have like an amazing child story or that you could share?
Yeah, tons. I'll share, I guess, the most just recent one. We had a baby come in, and the baby was suffering from colic and reflux. They were unable to hold down food, and constipation as well. And during the baby's 4th adjustment, the baby let us know that his constipation had improved. You can imagine what that looked like. He started getting regular right in the office. And mom said that baby was sleeping better and holding down food, and the baby started gaining weight. Whereas before it looked like it was going to be a chronic issue of him not being able to gain weight and develop properly. That's just the most recent one. I'm sure there's more amazing stories, but that I always like telling that one.
Yeah. Something simple though, but it can make such an impact. Oh my gosh, on that child and the family. Goodness.
And there's very little side effects for the child. So it's always like, for me, I don't like to give my son medicine, even though I'm a pharmacist. I'm like, no, let your body fight off whatever you're fighting. But it's nice to have the chiropractor. Like I've had them fit him in. I mean, there's usually not much you can do for an ear infection, especially if it's viral. And so it's nice to at least have that option where they can I think it was like, make sure like the fluid's draining properly. I'm sure you guys will go into this about the technicalities. I'm like, I don't know how it works, but he didn't have to be put on antibiotics the couple times we were able to get him into the chiropractor before it got worse. But yeah, it's very interesting. Digestion, like you were mentioning, was another big thing we've used chiropractors for. And so it's this whole other thing, like my mother never told me about this. So it's nice to be able to share this tool with other moms as an option. Like you don't necessarily need a drug, and you don't necessarily need an adjustment, but there's very little like side effect or risk when you're talking about the pressure of like touching a tomato or an avocado. Like that's a very light touch. And so I'm still just blown away, like those things work and that you can see results. As a mom, you know your kid, you know when they're not sleeping right, when they're agitated or irritated, and to like have a light switch that's like night and day. Or like my husband was always kind of like, where are you taking him? What are you doing? And then he'd see a difference and he's like, oh, yeah, he can go there again. But yes, I'm curious to learn more about this ear infections and what you guys kind of do in those situations.
Yeah, absolutely. You want to talk about that?
Sure. So actually, I'll bring up that little diagram again because it's actually easier. I'm a visual person for sure. I learn. Let's see. It's not actually diagrammed on here, but the tube that connects from our ear canal and drains into our throat and mouth, and also our nose drains into that as well, runs right in front of, again, that first bone in our neck. It's the atlas vertebrae right here. And the way that the atlas misaligns can be, oh yeah, that'd be awesome. So again, this is the first bone in our neck up here. So it will misalign in a rotational way. And so when it does that, the tube that runs from our ear to our throat sits right in front of that. So if it rotates forward, it closes off that tube, not allowing that fluid to drain from the ear properly into the throat and into the stomach, where our immune system takes care of the virus or the bacteria. So what we do is align that bone, reopen that tube, and for those fluids to drain and for our immune system to work the way that it was designed to work. Also, the nerves that pass through this bone right here also go to control the ears as well. And so if we have a misalignment there and our nerves aren't functioning the way they should, our ears aren't draining the way they should, our body's not knowing or communicating properly that there is actually something, an issue with the ears.
A good analogy for ear infections and the canals is like if you take water that's moving, like a creek, flows fine, nothing goes wrong. All of a sudden, it's not flowing like it should. Now it's no longer a nice creek, it turns into a swamp, and now bacteria and other stuff can sit and stagnate there and cause issues. When you have proper flow, things are just moving through and being taken care of like they should. Just a good analogy.
Absolutely. That's so
we saved a lot of infants from having to actually receive tubes because their ear infections have gotten so bad and the fluid hasn't drained. And so we've actually prevented children from having to get their surgery for those issues as well. And let alone taking antibiotics. Because we know that, antibiotics are necessary in certain situations. But they do wipe out a lot of our immune system, the good bacteria in our body. And so we want to, as naturally as we can, treat or help infants develop the way they should with a good gut flora and all that.
Do you have to do any different adjustments if they do have tubes in their ears?
Nope. Okay. Nope, we would do the exact same thing if they did or didn't have tubes.
Well, and the other thing with the antibiotics is they can cause diarrhea in kids or anybody, and that also then you have a whole nother issue with the diarrhea and all these side effects and resistance. Of course, we all know that antibiotics have been overused to where now we have a resistance issue. So being a good steward for antibiotics is really great to have this other option.
Right. And like we said, there are certain circumstances where, there's nothing else to do but take antibiotics. And, we understand that as well. But we also, there's a ton of research out there. If the infant takes antibiotics before 6 months old, they've done a longitudinal study and showing they're more likely, 100% more likely to have asthma, allergies, what else? Eczema.
Modern things.
Yeah, so as much as we can prevent from 0 to 6 months old getting antibiotics, we know that we're helping them long term.
Absolutely. Well, that's cool, you guys. Well,
how long did it take you to go through your chiropractic school?
So credit hour wise, it's an 8-year program if you added all the credit up. But we went through the expedited version, so they cram all those credit hours into 3.5 years. Almost 4 years, yeah.
4,200 hours of classroom, laboratory, and clinical experience. 4,200 hours. I didn't realize.
That's a lot.
Yeah. It felt like more, but I didn't realize that's a big number.
And we've also taken extra courses. So, to be certified and specialize in pediatrics and maternal care, you take extra courses as well as certain techniques. So on top of just the core credit hours, there's additional training that we do as well.
And you guys have to test, right? Have a national test or that you have to pass, and a law test you have to pass, just like most other health professions.
Right. We have 4 boards, actually, we take throughout our entire schooling. The first one is like a science-based. The second one's like neurology-based. The third one is more clinical questions. And the fourth one is actually you performing all these tests, exams, adjustments.
Screening people and looking for red flags. Even the x-rays we have to study or test on will have cancers and other things that we need to be able to also catch and look for as well.
Very interesting. And so I take it you guys have to do CEs like all the other ones to renew. Okay. And then did you have to do undergrad type courses to get in?
Right. You have to have an undergraduate degree.
Beyond an AA or BS?
Oh, BS.
Bachelor's, yeah.
Okay.
Yeah, so there's certain requirements as far as what science and lab hours you need going into chiropractic.
Interesting. And where'd you guys go to school?
Went to UF, both of us.
And then the Palmer College of Chiropractic in Florida.
Okay.
And where is that located?
It's in Port Orange, Florida, which is just the next city south of Daytona.
Mm-hmm. And then how does your work, I know all chiropractors are kind of different. Do you have like a long day, a short day, or how did you design it to kind of best fit your lifestyle?
We designed it around people and what their jobs look like. So our hours are when people go on their lunch breaks, we want to be available to them then. And when people are getting off work, we want to be available to them then. So most days we're open 10 to 1, 3 to 6. And there's people going on lunch, and then when they get off work, we're there for them. So it can make for some late nights, and it's tougher when you're in the office till 6:30 or 7, but it's all worth it, and we just love being available for people.
Very interesting. And then you're pretty much working Monday through Friday, or you do weekends as well?
For Monday through Thursday. We haven't opened up for Friday yet. We're kind of seeing we can take the general load Monday through Thursday, and if we get too busy where we need to start opening up hours so we can see people and practice members, we will open up the Friday hours. But our goal is if someone calls in for a new patient appointment, we see them that day or the next day.
Oh, nice.
That's cool.
And if a current practice member needs to get in, saying they're having a flare-up, they can come in that day.
Gotcha. And how long are your typical appointments, like new member versus just a walk-in that's established?
Right. We take a lot of care and concern and education with new practice members because if they don't understand what we do and what chiropractic can do for them, then they're not going to understand why they need as much care as we've recommended. And so we spend a majority of the first appointment kind of educating them on what chiropractic is, doing their exams, going over their health history. We use state-of-the-art technology to actually get a scan of their nervous system and see how it's functioning. So we can see areas that aren't functioning as well. And we use that throughout their care, as well as if we call for x-rays, we'll get x-rays that day. Then following their next appointment is a new patient orientation. And so that's where me and Dr. Shane will stand up there and kind of, again, go into more detail of what chiropractic is, what it does, what health is, what we do in this office, how we're different as chiropractors. There's a lot of different ways that you were saying that chiropractors practice. And so we just want them to fully, completely understand what we do, what they're going to receive in our office, and then receive their adjustments. And so we understand that those appointments are going to be longer in the beginning for them. But once they're past that, we average from 15 to 25 minutes for an appointment.
And then are you also billing insurance, or are most of your clients cash pay?
We accept insurance, but we have kept our cash price real low because we want to be able to see the whole family. And so if our rate was what the national or what Florida average is, which is $85 an adjustment, we wouldn't be able to see entire families. And that's not what we're trying to do. And so our cash rate is normally 95% of the time cheaper than going through their insurance anyway.
Gotcha. Yeah, that's what I find typically. It's like by the time you like throw it at your insurance, it's like way more if you just would have been like, here's the cash, gotta go.
And so we also strive to build long-lasting relationships built on trust. So in our office, we'll never perform a service on them without them first knowing how much that service is going to cost. So we look up their insurance, we lay it all out for them, and they can make an informed decision about finances before anything is rendered.
And we do have listeners from all over. I know, especially Shane, with you growing up as it's normal, and you luckily had a family member, your own dad, be able to adjust you. But what should people, whether they're pharmacists or technicians or just our family members, what should we advise them to look for in a chiropractor to make sure they're seeing somebody who's well trusted or I guess makes the correct adjustments? I don't know if there's something we should be looking for, a certain certification.
Yeah, that's a great question. I tend to look for people who are more focused on chiropractic care when I look for a chiropractor. And it's not that all people that provide supplements and different things are not good chiropractors, so don't get me wrong. But I think when you start to mix in a bunch of selling supplements and selling different things, pillows and all kinds of stuff, there can be issues with the balance between what the patient needs and you're making money off of these different supplements and stuff. So I like to look for a chiropractor who's really focused on realigning the spine and taking care of the spine and the nervous system, and not trying to do a whole bunch of different things. I think that's an important thing to look for.
Also, if they don't have x-ray is really important to be very specific in their care, because we can feel misalignments in your spine, but through the x-rays we actually see exactly how they're misaligned and what curves in your spine you have or what curves you're lacking in your spine as well. So that changes the way that our treatment of that practice member goes.
Do you typically just x-ray once for the new patient, or do you have it yearly, or how's that work?
We x-ray if we call for it in the beginning, and then we also do an updated one when they finish their care or the recommended schedule of correction for them.
To look at how they're progressing and see those changes. And people like to see improvement change. It's one thing to to feel better, but to actually see that you're functionally and structurally and physiologically better is exciting to see. So we provide all that.
And we do have practice members that are under care for wellness and in maintenance. And so with them, they don't get x-rayed as frequently, right? Because they're under maintenance, they're holding their adjustments. And so they're not x-rayed every single time their care plan is up.
So I think it's really cool that you guys highlighted like hypertension and the children's ear infections, because I think for those of us who do think of chiropractic, we think of like injuries or back pain or like some kind of pain that you're fixing, not necessarily something that is chronic, like high blood pressure or something that would be like infectious, like an ear infection. So thank you for highlighting those. I think that's very important, because I think people just think about injuries, like you're in a car accident, you go to a chiropractor. You know, that's kind of what people think.
Yeah.
I sure appreciate your time. I think we're about out of time for our recording feature.
You have to come back. You guys have to come back and tell us about something new. Like maybe you can be a recurring kind of guest or something and talk about a new topic. That would be really cool.
Yeah, we would love it.
For sure.
And thank you for having us.
Yeah. And so for all your listeners, we'll make sure we get all that information in the information box below for you guys, how to reach out to Dr. Brittany and Dr. Shane and all the great resources that they mentioned as well.
Yeah.
Thank
definitely.
you. I'm Bryn. This is Heather. These are wonderful chiropractors, Brittany and Shane. Thank you so much. And keep subscribing and watching Pharmacists Out of the Box.
Pharmacists Out of the Box. Go ahead, Shane. We have a few more minutes. It's okay.
One thing that we can also provide, we have these e-reports and made by Keith Wassong, and they're great information. A lot of stuff we talked about is in here, and so we can also share those with y'all. And here's a little preview of that, and just some great research and stuff like that. So we'll make sure to make that available, or anybody that wants it, reach out to us.
Oh yeah, definitely. We can add that. No problem.
Nice.
We can add that. All right. Well, thank you so much, you guys.
Yeah, we love talking with y'all, and you guys love what y'all are doing.
Yes. No. So thank you to all of our guests. I'm going to open us all back up now. And so thank you so much. And to our audience, stay tuned. Hang in there. Dr. Brittany and Dr. Shane might be back again. And like Bryn said, this is Bryn and Heather. We're Pharmacists Out of the Box. See you next time.
Bye.